This is Tori Swindle, and I'm going to be showing you how to do a wet to dry dressing. Checking my physician's order, knock on the door, place my boats down, hand hygiene. Hello, Miss Fair. My name is Tori Swindle, and I'm going to be your nurse today. How are you feeling? Okay, can you tell me your name and date of birth? Thank you. Are you in any type of pain? No? Okay, good. If she was in any type of pain, I would administer her pain medications, but then I would have to wait 30 minutes before I can go back and do the procedure. All right, Miss Fair, are you allergic to anything? Shellfish, iodine, alcohol, latex? Okay, good. Have you ever had a wet to dry dressing before? No? Okay, well what we're going to start off is we're going to take off your old dressing. We're going to do a couple assessments on it to make sure it looks okay, but then we're going to have to reapply a new wet to dry dressing. Okay, well I'm going to get everything set up for you and then we'll start. I'm going to cleanse my table. Get all my supplies. Make sure I'm only touching that 1/2 inch border and shiny side is down. Okay. Now I'm going to open up my boat. Make sure that it goes away and dump. My sterile saline, open it away and dump. My culture Q-tip, open away and dump. My combine post and dump. My sterile gloves I can put here, and then my second 4x4 away and over here to the side. Okay, I'm going to grab my normal saline and I'm going to put my hand over the label so I know which side I put it on. I'm checking the expiration date to make sure it's still good. Over to my garbage can, I'm going to pour and then lip it. Go ahead and pour into my container. Set it to the side so I don't need it. Alright, Miss Fair, I've got the privacy curtains closed and I'm going to pull back on your pull back on your sheets. Is that okay? Show the wound right here so I don't touch or go over my field. Gonna pull from that corner. Gonna mark it around. Okay, I'm gonna pinch and pull. I'm looking at my gauze here, and I'm looking at Coach, which is color, odor, amount, consistency, and how the patient tolerated. I'm looking at the incision, and I'm looking at Rita, which is redness, edema, ecchymosis, drainage, and the amount. I see no redness, I see no edema or ecchymosis. The drainage looks good. There's not much showing on the pad. Now I'm gonna roll it in my glove. Throw away. Perform hand hygiene again. Okay. Before I put on my sterile gloves, since my table is clean, I'm going to go ahead and tear the pieces of tape that I need. You need 4 to do the window, and then you need 1 to have your name, time, and date that it was done, so they can keep up with how many hours in between it needs to be changed. Okay. I'm going to grab my sterile gloves. And taunted. I will fix that once I get my other glove on. Now, since I have these on, I can go ahead and rearrange my supplies as needed. Okay. Dispose. Gonna grab my wet 4x4. Do my little wonton. I'm going to go down the insertion site and toss. I'm going to go away from me and toss. And I'm going to go here and toss. Alright, now since I cleaned it, I am going to grab my culture. And I'm just going to go down here and go around. And then I would stick it in a tube and place it. After it's stuck in the tube, I would have my name, the date, and the time on it, and then I would toss it right there, and whenever I got done with everything else, I would be able to send it off to lab. Okay, now I'm going to irrigate the wound. All right, Miss Bear, can you turn on your side for me? I would have her on her side and I would irrigate it until it ran clear. Okay. And toss. Pause. Okay, I'm gonna grab my wet gauze and fold it in half. Place one right there. I'm gonna grab my other one. I'm gonna grab my second wet one, fold it, and place it. Then I'm going to grab my dry gauze and fold it, place it. Other one, and place it. And then my dressing. Grab my tape. Go down the side. The other side. Here. And here. I'm gonna take off my gloves, discard, and hygiene. Take my next tape. And I'm gonna sign it. Time and date. Alright, I'm gonna cover her back up. I'm gonna gather up all of my garbage and I'm gonna dispose. I'm gonna send my culture to lab, or I'm gonna call one of the CNAs, PCAs, to see if they can go send it to lab. And then I'm gonna educate Miss Bear about if there's excessive drainage that's coming in her wound, that she needs to call us and let us know. If she starts getting severe pain, if it starts to get swelling, if it's red, that means that there's a type of infection. And then I'm gonna educate her to try not to sit up because it's going to put more pressure on the abdomen. I've got the call light in reach. I've got the bed lower down to the safest position. I will document the time and date that the procedure was done. I will document Coach and Rita, which is color, odor, amount, consistency, how the patient tolerated, redness, edema, ecchymosis, drainage, and amount. I will also note that she was at no pain when it was going on and state that the patient done fine during the dressing. And then I would call it a day.